Hi there, I'm back with another quick update on my hip replacement surgery. Yeah, everything's all worked out. I got the cardiologist thing under my belt. It was really complicated, but big shout out to my primary care doctor's nurse Jill. She really helped me out a lot. She booked another cardiologist appointment for me. There was so many obstacles to overcome because I don't know, for some reason the old provider was having a hard time providing the records, so she gave up on trying to go with a provider in that group. She went with a different cardiologist, I guess, from the network that my doctor's with. That's University of Chicago. So I don't know. Then I had requested my records directly from that place. I had emailed in a request for a copy for me and to also have it faxed over to my doctor's office. So they did come through with faxing it over to my doctor's office. I personally did not get a copy. But in any case, Jill called from my doctor's office yesterday and she told me that uh, I was cleared. The cardiologist had already cleared me. The only issue was that my blood pressure was kind of high, so she had put me on another blood pressure medication, and I guess the follow through was to see if it lowered my blood pressure. So actually my blood pressure went up, probably a lot of the stress of having these cardiologist appointments canceled and not being able to reschedule. And my surgery's coming up and I didn't want to have to not be able to get clearance for the surgery. So it turned out, yeah, she already did give me the clearance. The follow-up was just about the blood pressure medication. So then she says, well, you're already cleared, so you don't even need the other cardiologist appointment, so you can go ahead and call and cancel that, which I did. And I'm just going to keep monitoring my blood pressure with my home blood pressure monitor, and then I have an appointment to go see my primary care doctor next month before the surgery. And, if any changes need to be made, we'll change them. Because apparently they doubled up my amlodipine blood pressure medication, and apparently that can make your blood pressure go too low too. So I got to keep an eye on that. I don't want it to go too high or too low. I just got to keep an eye on it. So yeah. But in any case, everything seems to be back on track again. Today I had to go for a physical therapy evaluation session, and that was all the way in Hyde Park. And today, we're supposed to get a tornado. We're still waiting to see if that's going to happen. But there was a lot of rain in the morning, so it was quite a sloppy mess trying to get into the city and into Hyde Park and over to the University of Chicago. But in any case, I made it, and that's done. And I have a sheet. Well, she went over some of the physical therapy techniques I'm supposed to do. And yeah, I have to get in contact with the local physical therapy place and figure out how I get into that. I got to do all this stuff. I still have to do some stuff, but nothing's critical. Everything is on track, and it's just follow-up stuff. Well, not follow-up, but just things I got to do. But I've also bought some medical supplies. I got that through my health insurance's pharmacy. They give me a $400 allowance per year. So I got all the necessary equipments. What did she say? Oh, I might want to get a cane. I don't know. We'll see. I have a walker. I got a walker for $5 at the thrift store. It's a real nice walker. And I got Oh, the raised toilet seat. I got that from my health insurance pharmacy. And I also got, what is that called? A shower seat. The kind where it's inside and outside, because I won't be able to, move my leg to get in and out of the tub like that. So I guess I have to sit down on the seat and then transfer over to the shower side. I don't know. Just a minute. There's another thing I got. A couple things. I have returned. I got this thing. This is a stand-up shoehorn, so I can put my shoes on by myself. And this right here, I'll take my socks off. I can use that to take my socks off. What else? I have this thing. This is, I put my leg in here so that I can lift my leg to get in and out of the bed, because you're supposed to keep your legs straightened, so this will help me to do that. Let's see if I can pull the bar back enough to demonstrate. This is not the right leg, but okay, first you gotta hook the little puppy in there. There we go. There you go. You hook your foot in and then you can move it around. Just like that. What else do we have here? Just a minute. I have one of these things. That's a grabber. Everybody knows these things. Grab things. In case I drop something, like maybe my sock. And this thing, this is supposed to help you put your sock on. Apparently, what you do is you put your leg in there, and then you wrap your sock around there, and then I guess you pull it up. I'm going to have to watch a YouTube video to get the technique on how to do that, but it's a thing. And what else do we have here? Oh, they taught me how to use the walker today. I didn't know there was a particular technique to it, but there is. Let me show you. This is the walker I got. This was $5 at the thrift store. Pretty good price, I'd say. But yeah, mine is kind of tall. I guess you can take it down. Maybe I do want to take it down some, because the one she had at the physical therapy place was lower. It was shaped like this though. So anyway, let's see. She says you're supposed to, you start like this, then you roll it forward, step into it with your good leg, follow up, stop, push it forwards, follow up, and that's apparently how you do. She showed me how to go up the stairs too. You're supposed to, what is it? I don't know, there's some little rhyme that goes with it, but basically you put your injured leg, your surgery leg up first, and you only go step by step. So, yeah. Susie. Okay, I found my paperwork here. It says, Patient's Guide to Total Hip Replacement and Home Exercise Program. Do not extend your leg behind you. Do not turn your toes outward. Post-operative day 1. You will have physical therapy twice per day while in the hospital. You should continue to perform the exercises attached outside of therapy sessions. Physical therapists will continue to help you progress your tolerance to functional activities, including getting into and out of bed, sitting down, and standing up and walking. You should increase your time spent out of bed and sitting in your bedside chair to improve your endurance. You may be instructed on climbing stairs as tolerated and appropriate. Durable medical equipment, assistive devices. You'll likely require an assistive device to aid you in your recovery process and assist you when walking and performing daily hygiene tasks. Below are some pieces of equipment that may be beneficial for you during your recovery process. Assistive devices: rolling walker, 2 wheels, straight cane, sock aid, long-handled reacher. I have all of those except the cane. I'm not sure if I should actually get a cane. I don't know. We'll see. Bathroom: commode, raised toilet seat, shower chair, grab bars by toilet and tub. I'm not sure what they mean by commode. Doesn't that mean the toilet? I have a toilet. It's a house. I have the raised toilet seat. I have the shower chair. I have a grab bar, but I didn't install it because I'm not too sure if it would actually be helpful, because in my bathroom, I could grab onto, there's a half wall and the bathroom sink. That's what I usually do, is just lift myself from there, so I don't know if it's needed. Make sure to pick up and move any throw rugs, chairs, extensions cord, etc. that are in your path. Keep items you frequently use on shelves at your waist height to avoid the need to bend down. Bathroom: you may benefit from raised toilet seat, shower chair, grab bars. Yeah, okay. Pets: be careful around pets when you return home, as they can become a safety hazard. Yeah, I gotta watch my little cat Zoey. She's a kitten. But she's getting older now. She's 9 months old, so she's slowing down. Stairs: ensure handrails are secure. If you do not have them, consider installing them. I have handrails. Car transfer: after your surgery, you may need some assistance when getting into and out of a car. Below is the safest way to exit, enter. Push the front passenger chair all the way back prior to getting into the car. Walk toward the car using your appropriate assistive device. When close to the car, begin to turn around, backing up, blah, blah. I don't know. This sounds like self-evident, really. Stair negotiation: think up with the good and down with the bad. Always lead with your stronger leg, the non-surgical, when going up the stairs. Oh, I did it wrong in my physical therapy thing where she was showing. It's the wait. Yeah. Up with the good, down. Oh, wait. Oh, okay. No, I went up with my. Okay. Oh, I have to put my left leg up first. Oh. Up with the good, down with the bad. Up with the good, down with the bad. Lead with your stronger non-surgical leg when going up the stairs. Bring your surgical leg down first when you're coming down the stairs. Hold on to the handrail with one or both hands. If you have a cane, it's okay to use it for more stability. Hold on to the handrail. Ascending the stairs. Blah, blah. Okay. Up with the good, down with the bad. Okay. I'll probably remember that once I'm actually post-op. Oh, and there's some exercises here that I'm supposed to do. This is the simple one where you Lie on your back with legs straight. Bend your ankles and push your knees down firmly against the bed. Hold for 5 seconds. Okay. Just little exercises to do to keep... You don't want to get blood clots. Oh, blood clot. So, yeah. In any case, I'll be going over this more as the date gets closer. It's August 6th. So I still got to finish out this month and next month. But I like to just try to be as prepared as possible. I did my little home repair things. I finished up those projects, and now I want to go down to the basement and just clear everything out. I want to just get rid of all the cardboard boxes I've been saving, because I'm not going to be doing any selling on eBay again, at least not shipping wise. And yeah, there's a bunch of old electronic stuff. It's time to get rid of that stuff too. That's some kind of special. Did that electronics recycling. I have to call the sanitary district in my town to schedule that. But in any case, yeah, I'll keep myself busy with my little projects until the surgery actually comes up. And, well, looks like my blood pressure is going down. They doubled up the dose of the medication, so it's going down. And I guess everything is on track again, unless anything unforeseen pops up. I'm on track again. So August 6th. And then I'll try to recover as thoroughly and quickly as I can. And we start the process with the left hip, because I have to have both the left and right hips replaced, bone on bone. So, in any case, I'm back on track. All's good. And hey, it's been up and down, but, I'm going to get it done. So, thanks for stopping in, and have a great one. Bye now.